Nusinersen came out in December 2016, and this was a very huge event for SMA patients because this was the first drug that we've had or the first medication that would actually treat the underlying disease cause. Nusinersen specifically, when we talk about the disease, we talk about SMN1 and SMN2. And SMN2 is a slightly abnormal, 1% of it is abnormal compared to the normal SMN1. Now, if you bring nusinersen in, it can change the way the protein is produced in SMN2, so it becomes more like SMN1. It doesn't replace SMN1, but it kind of helps to make it function more like SMN1. When you can increase that amount of functional SMN1, you now provide the body with the tools it needs to fight this disease. So the introduction of a medication in 2016 that now allowed us to directly go in and correct the genetic abnormality was huge. We've never had an opportunity like that in neurology, and we now, in the clinical trials that got it FDA approved, kids that typically wouldn't have been able to walk, now with this introduction had dramatic improvements and have been able to walk. It's been approved across all stages and all ages of SMA because of its benefit. So nusinersen has been FDA approved across all stages of SMA, all different groups 1, 2, 3, and 4. And we know from the data, it looks like the earlier you get it in the disease course, the more the benefit, but this is still being analyzed. This is still being looked at. It is given through an intrathecal injection, that is, they've got to do the spinal cord injection. The spinal fluid injection, so you need a lumbar puncture in order to do it. And there's a set program that they have in place for how frequently it has to do. For the most part, it is very well tolerated, except for the obvious complications that can happen from doing any sort of spinal tap. The other potential risks that come through it is glomerulonephritis and thrombocytopenia. So prior to any injections, you have to check the liver, you have to check the blood counts as well as the renal function, looking for any proteinuria.
The approval of nusinersen includes all types of 5q SMA, independent of disease severity and independent of patient's age. So when you have a confirmed 5q SMA, you can start treatment with nusinersen. The mechanism of action of nusinersen is that nusinersen is an antisense oligonucleotide, so it is some kind of single-strained genetic information binding to the RNA, and therefore it includes the exon 7 within the transcript. And this is the problem you have with the SMN2 copy number, which codes for a truncated protein with some kind of defect in contrast to the SMN1 gene. So you make, with nusinersen, an intact SMN gene out of the defect SMN2 gene. And this is the mode of action of nusinersen. And it has to be administered via intrathecal injection, via a lumbar puncture, because it cannot cross the blood-brain barrier. And it has to be administered 6 times within the first year of treatment. 4 injections are within the first 2 months, some kind of loading phase. And then you have a maintenance phase with repeated injections every 4 months. And for each injection, independent of SMA type and age, you inject 12 milligrams of nusinersen.